Everyone, welcome to Nurses Said. This is going to be a brand new episode of this channel, and of course today we'll have to begin a new series, and we will be calling that one as Understand E.A.S.I.E.R. So this Understand E.A.S.I.E.R is a mnemonic. E.A.S.I.E.R is a mnemonic in order for us to understand a specific disease condition a bit easier for everyone who's actually enrolled in the nursing school or is about to take the board examinations, or even any examinations that will actually be of help, especially in this specific topic. But of course, the E.A.S.I.E.R is gonna be composed of the following letters: letter E, letter A, letter S, letter I, letter E, and of course letter R. Let's have letter E. Letter E is explain briefly. So of course we'll have to explain the condition as brief as possible. Letter A is assessment key, so we focus more on what are the hallmark symptoms or manifestations of the condition. Letter S, that's gonna be your special diagnostics. So we talk about the diagnostic evaluations that is actually being used in this specific condition. Letter I, that's going to be the instituted treatment. So we'll talk about the medical management, the surgical management, and of course other forms of management that is all about the condition. Then letter E, that's going to be your elaborated nursing measures or the elaborated nursing actions, which talk about the nursing measures that is very important for us nurses. And of course letter R is going to be your reinforced teaching. So we focus more on what are the teachings that will be included in that specific condition. So that will be the beginning of our first episode of our Understand E.A.S.I.E.R. So our first topic this morning or this day is going to focus more on glaucoma. So we have to understand glaucoma the easiest way or the easier way. So this will be the beginning of our Understand E.A.S.I.E.R series. Okay, so the first one, which talk about the explain briefly. When we talk about the explain briefly, it is very important for us to remember that when we talked about glaucoma, this is a specific condition in which there is an increase in the intraocular pressure. So of course we know that the normal intraocular pressure ranges from 10 to 21 millimeters mercury. So therefore the intraocular pressure for patients with glaucoma is going to be more than 22 millimeters mercury. And then this condition is considered to be there is a progressive loss of peripheral vision. So just take note, for individuals with glaucoma, there is an intact central vision. What is greatly affected is going to be your peripheral vision. The peripheral vision is going to have its progressive loss. Next is, this is considered to be a condition in which it causes optic nerve atrophy. So therefore it damages the optic nerve because of the progressive because of the pressure that is actually present. And at the same time, this condition is going to be chronic, and if that's going to be chronic, that's why it is being called as a progressive condition, because it has a chronic it is a chronic condition. And of course this glaucoma is considered to be the third leading causes of blindness in the United States and of course in other areas of the world. So most of the time this condition is going to be causing blindness because of course it is mentioned that it causes your optic nerve atrophy. And of course we have this three main types of the glaucoma. We have your primary open angle glaucoma, and at the same time we also have your primary angle closure glaucoma. So if you're taking into consideration this one, your primary angle closure glaucoma is considered to be requiring an emergency management. That's why there is a need for this patient to have probably an emergency surgery, because of course there will be a need for this patient to restore or probably prevent the peripheral vision from losing immediately. And of course we have the third one, which is going to be your secondary glaucoma. Our secondary glaucoma is going to be caused by other pre-morbid conditions of the patient, such as your diabetes mellitus and other conditions or pre-morbid conditions that causes the pressure of your aqueous humor or your intraocular pressure to increase. So these are the types of glaucoma. When we talk about glaucoma also, it's very important for us to take into consideration that this glaucoma is going to be involving risk factors, and most of all, the first thing that we need to do to think about glaucoma is considered to be with familial tendency. So it is actually highlighted in yellow color because of course being or having this familial tendency is common board questions or common examination questions in any form of exams. So therefore, we are going to take into consideration that this glaucoma is brought about by a hereditary factor. Next to that is glaucoma is associated also with age. So therefore, individuals who are actually at risk for the development of glaucoma, especially for those who are actually aging 40 years old and above. Next to that is presence of emotional disturbances, because of course if you're going to have emotional disturbances, there will be an increased possibility that you might as well have developed your increased production of the aqueous humor, and that increased production of the aqueous humor is going to increase also your intraocular pressure. Next is chronic diseases. We had mentioned earlier that secondary glaucoma is going to be developed because of presence of diabetes or any other conditions that are actually chronic, in which this will progress towards the development of increase in your aqueous humor, and that will progress to the development also of an increase in your intraocular pressure. Next is of course allergies. So allergic reactions can actually cause productions of secretions. That's why there will then be possibility that this individual who is actually going to be at risk of having glaucoma will also have an increase in tendency of having increase in intraocular pressure also. And of course, next is your vasomotor disturbances. When we talk about vasomotor disturbances, it means that you're talking about either vasodilation or vasoconstriction. So if there will be disturbances of your vascular structure, so therefore this is also a factor for the development of your glaucoma. And of course, if there will be eye injury, such as for example eye trauma, so that trauma could also be a factor for the development of your glaucoma. And the treatment of your glaucoma are actually going to be focused more on stopping the progression of the condition. But if we're talking about the treatment does not restore your lost vision. So if there will be loss of your peripheral vision already, so that is already lost, but it will not be restored. Let us proceed now to the patient's assessment key. So when we talk about assessment key, what are the key factors that you're going to look into, especially when you talk about the presence of glaucoma? So of course, we focus first on the subjective manifestations. Of course, when you talk about acute closed angle glaucoma, this patient will manifest pain, and that pain is considered to be severe in and around the eye. So therefore, it's expected that this patient will be complaining of pain in and around the eyes. Next is there's presence of rainbow halos around lights. So this is highlighted with yellow because this is also going to be very common in the questions of the board examinations. Rainbow, or there will be colored halos around lights. And of course, another one is presence of tunnel vision. So when you say tunnel vision, it means that there is already a very small form of vision. That's why that the tunnel vision is actually a manifestation that the central vision is intact, but the peripheral vision is already being damaged or is already damaged. And patient also will be manifesting blurring of vision, and of course patient will be having nausea and vomiting. So this nausea and vomiting is brought about by having an occipital headache, and that occipital headache is the reason why this patient will have this feeling of nausea and vomiting. For chronic or your open angle, this patient will complain of the eyes will usually tire easily, and at the same time there will be presence of this dull morning headache, and usually that dull morning headache is brought about by an occipital headache, also associated with the occipital headache that is actually present with glaucoma. Next is, aside from that, is we are going to take into consideration now the assessment key, which is going to be objective. And if that's going to be objective, patient will be having corneal edema. There will then be presence of your decreased peripheral vision, and at the same time there will be an increase in your cupping of optic disc. So these are actually present for individuals having glaucoma. And of course, via your tonometry reading, the patient will have your intraocular pressure reading, which is more than 22 millimeters mercury, which is in which normal is 10 to 21 millimeters mercury only. And of course, this patient is actually having dilated pupils. So it is actually highlighted because it's also going to be a board question, common board question, in which if this patient has dilated pupils, this patient will not be given your mydriatics. And also this patient will have redness of the eye. Nursing diagnosis, that is actually common for this patient to have had glaucoma includes visual, sensory, perceptual alterations that's actually related to increase in intraocular pressure. Next is pain related to sudden increase in IOP. And then of course, next is risk pre-injury related to blindness. This is actually highlighted in yellow because of course this is also common in the board questions, in which the patient having glaucoma is going to be prevented from having injury. It's because of course injury is going to be prevented, especially if there is presence of glaucoma, because of course injury can actually be present. It's probably because of the presence of blindness. And of course lastly is your impaired physical mobility related to impaired vision. Let's proceed now to your special tests or the diagnostic evaluation. So this patient is actually going to be subjected to slit lamp in order to determine if there is actually going to be presence of your overproduction of the aqueous humor. Next is tonometry reading, in which you are going to identify the pressure of your intraocular pressure, in which clients with glaucoma are actually going to have an increase of your IOP more than 22 millimeters mercury. And of course, this patient is also going to be assessed with visual field tests. So you are going to identify if the patient can see at the periphery or in the central vision. And of course, next is your ophthalmoscopic examination. So this patient is going to have this evaluation of the visual acuity also, but of course, because through this ophthalmoscopic examination, you will be able to identify what is the degree of damage that is actually present in the patient's vision. Next is we are going to focus more on the instituted treatment. So these are the possible treatment that the patient can actually undergo. And of course, for acute angle closure glaucoma, this patient is going to be given your cholinergics, and at the same time your hyperosmotic drugs. So this hyperosmotic drugs is highlighted with yellow because of course this is a common board question. And at the same time, these hyperosmotic drugs are actually being given to the patient. It's because of course this patient needs to have release of the buildup of the aqueous humor, and that is going to be done through the administration of these hyperosmotic drugs. And also, this patient is a candidate for possible laser peripheral iridotomy, in which there will be creation of an opening in the iris that will actually going to increase the outflow of your aqueous humor. And of course, this patient could also be having or a candidate for surgical iridectomy. And this surgical iridectomy is also going to be a form of creation of a hole in the iris that will actually going to increase the outflow of your aqueous humor. And of course, you can have your chronic open angle glaucoma, and the management includes your beta blockers that could possibly include your temolol or any form of beta blockers, because beta blockers could also have an effect in the decrease of the production of your aqueous humor. And also this patient could have been given your adrenergic antagonist, and meiotic drugs or meiotics are actually going to be given. It is highlighted yellow because this is also going to be common, and the most common example of your meiotics includes your pilocarpine or your carbachol. And another form of instituted treatment for this patient includes your surgical management, and that includes your argon laser trabeculoplasty. So when you say argon laser trabeculoplasty, that's going to be a creation also of a hole that will actually allow the outflow of your aqueous humor. And then of course, you can have your trabeculectomy. That's going to be creation also of a hole then. And sometimes this patient is going to be subject for a cryotherapy, in which that is focused more on the destruction of your ciliary body, in which this ciliary body is the reason why there is going to be a production of the aqueous humor. So they will be damaging or destroying that ciliary body with the use of your cold probe, and that's going to be with the use of your cryotherapy. Another form of your management, and that includes your elaborated measures that includes your nursing management. So in our nursing management, we have to have our focus. The first focus is to reduce IOP or reduce intraocular pressure. So the very first thing that we need to do is to allow the patient to have an activity which is going to be focused on bed rest. Next is the position of our patient, and that has to be semi-Fowler's position, and that semi-Fowler's position could actually decrease the intraocular pressure of your patient. And of course, for medications, this patient is actually going to be given your miotics. As what I mentioned earlier, this miotic includes your pilocarpine or your carbachol, and this pilocarpine or carbachol is very important because this constricts the pupil. So we mentioned in our assessment that the patient has dilated pupil, so therefore this patient is given these miotics to constrict the pupil. And then of course, this patient will also be given your carbonic anhydrase inhibitor, and that is going to be your acetazolamide or your Diamox. So this will actually prevent also the more formation of your aqueous humor, and at the same time this patient could also be given your anticholinesterase or your Humorsol, and this is also going to be given because of course this will be of help especially in the outflow of your aqueous humor. And also this patient is being given your ophthalmic beta blockers, and the best example of that one is the administration of your Timolol. Another elaborated measures includes your goal is going to be focused more on provide emotional support. So we focus more on providing emotional support via placing personal objects within field of vision. So because that is going to be one way of providing support to our patient, because of course that will let the patient know that you are actually supporting the patient's loss of visual or loss of your peripheral vision. And at the same time, you have to assist the patient with activities of daily living, but of course you will not be promoting dependence there, but you are going to assist the patient especially upon moving or performance of the activities of daily living. And at the same time, you're going to let the patient encourage verbalizations of feelings, especially focusing more on anxiety and stress, and of course the fear of losing one's vision. So further, there is also going to be focused more on elaborated measures, and that includes your health teaching. And the health teaching is going to focus more on the prevention of increased IOP by avoiding the following. The first one is avoiding anger, super excitement or overexcitement, or having this worry. The second one is of course constrictive clothing, because of course that constrictive clothing is going to be a factor also of the prevention of the outflow of the aqueous humor. Next is heavy lifting. So as much as possible, there has to be no heavy lifting of the patient, especially if they are actually diagnosed with glaucoma. Next is excessive fluid intake. So you have to avoid excessive fluid intake because of course your aqueous humor is considered to be the fluid compartment or the fluid composition of the iris. And of course, you have to avoid atropine because of course atropine is mydriatics. So we have to make sure atropine is gonna be your anticholinergics. So you have to avoid this one from being given and other mydriatics, because of course that will prevent also the dilation of the patient's pupil. And at the same time, you have to let the patient avoid straining at school. That's why it's very important for us to remember that this patient must have to be given or must have to be prevented from having constipation. And of course, you prevent also the patient from having eye strain. So do not focus or do not allow the patient to have longer exposure to televisions or cell phones or laptop, because of course that can cause eye strain, or let the patient rest the eye for the meantime. And at the same time, do not let the patient read newspapers which has a very small font. So that's going to be one way of avoiding. And at the same time, you are going to avoid also, or you are going to possibly avoid stress, and of course that's why you are going to let the patient perform stress management activities. Another form of elaborated measures or nursing measures for this patient is including your medication compliance. So of course you have to take into consideration that when you talk about your medication compliance, you are going to teach a patient about the purpose, the dosage, and the frequency of the medication. And also you have to teach a patient about eye drop instillation. So you have to let the patient wash his or her hands prior to instillation, because of course you are going to take into consideration that the medication is administered aseptically. And of course you have to let the patient position his head back and expose the lower lid, and of course you are going to give the medication in the lower lid. And then of course close the patient's eyes gently, and if possible you can actually apply gentle pressure to avoid also the medication from getting out of the eyelid. And at the same time, wait for 2 minutes before administering the second or third drugs, because of course this duration is going to be enough also for the medication to be absorbed. And of course have extra drug bottle in case if there is breakage or loss of the bottle. Next elaborated measure includes your activity. So the patient is going to be encouraged to have moderate exercise, and that includes walking. And at the same time, you are going to include there your safety measures, and that safety measures includes your eye protection. So the patient is actually encouraged to have a face shield or eyeglasses. And at the same time, this patient is encouraged to have your medic alert bracelet or medic alert band, in order for people to know that this patient is actually having problems with vision. And at the same time, if the patient is having meiotic administration, please don't allow the patient to drive 1 to 2 hours after administration, because of course there will be presence of dizziness of the patient especially, or probably this patient can be sedated. And at the same time, that is brought about by the decrease in the, or there will be the constriction of the pupil then. And at the same time, of course, you are going to teach the patient about possible community resources for referral. Next, elaborated measure, reinforced teaching, is the reinforced teaching includes your follow-up and follow-up care importance. So you have to take into consideration that the patient is going to be well informed about the importance of having follow-up. Next is, of course, no rubbing of eyes. That will be focused also in our teaching. Next is, of course, you can correct your correct eye medication administration. You have to teach the patient about that one. And at the same time, avoid activities that increases your IOP. And of course, if pain is unrelieved by analgesics, you are going to call your primary caregiver or primary care provider. Included also in your reinforced teaching includes your evaluation criteria, and that includes eyesight is being preserved if possible. And at the same time, of course, part of your evaluation criteria is the intraocular pressure of your patient has been lowered to less than 22 millimeters mercury. And at the same time, there is continued medical supervision for life. Just remember, this patient having glaucoma can actually give or can actually be receiving the medication for life. So that is going to be the end of our first series of our Understand E.A.S.I.E.R. This has been Yucef Bahian Abang, the author of this channel, Nurse Jose. And of course, you can follow me in my social media account. If you're actually new to this channel, please don't forget to subscribe and hit the notification bell for you to be updated with the succeeding uploads of this channel. This has been Nurse Jose at your service to make your best better. Thank you.